And it might be the most common question I get, actually. Doc, I have arthritis all over my body. I'm sure this is just arthritis, but can you tell me if it is? So take some x-rays and you push around on their foot and you figure out exactly where the pain is located and what's causing it. And then if the x-rays show that there's arthritis on it, you know, that the joints have degenerated, they're breaking down, okay, so it's arthritis. There seems to be an idea out there that arthritis is something you have to live with. It is true that the damage done by joints breaking down over time, wear and tear arthritis, or any kind of arthritis, whatever is damaged is there. That damage remains. But it doesn't mean the symptoms have to remain. Oftentimes we can treat the symptoms and make patients much more comfortable. Let's say a patient is experiencing a lot of pain in their big toe joint. If you can give them a 50% reduction in their pain, it changes their lifestyle completely. They go from being able to do nothing to being able to do most of the things they want to do. It's worthwhile to treat arthritis. I actually have a lot of colleagues that seem to tell patients, you have arthritis, there's nothing we can do about it. And I have one colleague in the area who I hold in very high regard, and she seems to tell people that frequently. And I never understand, like, you're not going to try anything to reduce their symptoms? Arthritis is an inflammation of the joint. They've had the arthritis building for years. You can look at the x-rays and you see it's completely destroyed. But their symptoms have come about recently. So if it's just an acute flare of the fact that the joint is not working the way it's supposed to, a lot of times you can put them on an anti-inflammatory or have them icing properly, and their symptoms can diminish greatly, and what a relief for them. Other times you can give steroid injections and they'll feel much better. I have a patient that came in this past Tuesday and told me he needs another injection. I didn't remember ever giving him an injection. So I looked in his chart, and sure enough, 2.5 years ago, I gave him an injection for arthritis in his second toe joint. And he said it was fine until about 1.5 weeks ago, and now he's having a lot of trouble with it. Okay, we'll give him another injection. And if it holds up for another 2.5 years, that'd be great. So don't think just because you have arthritis, it's a lost cause and you got to live with it. That could be the case. I'm not telling you that in every case we can, give you a great relief of your symptoms, but most of the time you can. I would say most of the time, the vast majority of the time, there are ways to address it. And many times there are ways to address it surgically. So if you're in a situation where you've got debilitating arthritis and you still need to be active, there are surgeries that address arthritis, and you could dramatically improve your lifestyle. And we are all about dramatically improving our lifestyle at any age. So I'm with you on that. And if you have any questions about that, you could click the link below and make an appointment to talk to me at our ankle and foot virtual clinic, or you could send me an email, but I'd be happy to talk about that. Many times we can give you some really profound relief of arthritis. And so to not try it would be foolish. So if you liked what you heard, hit the like button, subscribe, and send it to your friends, share it with your friends. If you know anybody that's having foot problems, that's complaining to you all the time, you can tell them, complain to this guy, and send it to them. I look forward to hearing from you, and I hope that you found this helpful, and I'll look forward to seeing you next time.